Assalamualaikum warahmatullahi wabarakatuh to our beloved Madam Intan. Today, our group will present about the infographic from the chapter we choose in the syllabus. The first chapter is from the chapter 1, which is certain infectious and parasite disease. Infectious disease occur when a pathogen invades in the body and cause disease. So, the code range for this chapter is from category A00 to B99. But before we proceed with the first presenter, let's look into the infographic we made for the chapter 1, consists of case study, guidelines, and the code.
Okay, next I will proceed on the short case study that is related to this chapter. The case is on discharge summary note. This 34-year-old male patient is being discharged today to his home following an admission for acute appendicitis. During the admission, it was also determined that the patient is HIV positive. From the case, we can quote that the principal diagnosis PD as B20 human immunodeficiency virus HIV disease, and the secondary diagnosis SD as K35.80 unspecified acute appendicitis. Why we choose that code? Okay, in this case, the HIV code need to be coded first because the patient is previously diagnosed with HIV. So, he need to carry the B20 code as the primary diagnosis PD.
The guideline for this case is human immunodeficiency virus HIV infections, which is code only confirmed case. In this context, confirmation does not require documentation of positive serology or culture for HIV. The provider's diagnostic statement that the patient is HIV positive or has an HIV-related illness is sufficient. Next, the additional information is disease. Acute appendicitis is an inflammation of the appendix. This inflammation causes congestion, swelling, and ultimately reduce blood supply to the appendix. Acute appendicitis is a severe and sudden case of appendicitis. Signs and symptoms of appendicitis may include sudden pain that begins on the right side of the lower abdomen, sudden pain that begins around your navel and often shift to your lower right abdomen, pain that worsens if you cough, walk, or make other jarring movements, and loss of appetite. These symptoms tend to develop quickly over the course of 1 to 2 days. It requires immediate medical treatment. If left untreated, it can cause your appendix to rupture. This can be a serious and even fatal complication.
Okay, that is all for the chapter 1. Now we will move to the next chapter, which is neoplasm. Neoplasm are reported in the chapter 2 of ICD-10-CM. What is neoplasm? Neoplasm, also known as tumor, are defined as an uncontrolled abnormal growth of cells and are characterized as malignant or benign. The code range for this chapter is from category C00 to D49. As usual, before we proceed with the first presenter, let's take a look into the infographic we made for the chapter 2.
Now, we will move to the example of case that related to this chapter. Based on the slide, we can see the office visit note. This 65 years female patient will return to the office today for follow-up for her breast cancer. The cancer was treated 3 years ago via bilateral mastectomy, and at this time, she is showing no sign of recurrence of metastasis. Vital sign as recorded by nurse. Heart, normal rate and rhythm. Lungs, clear. Abdomen, soft, non-tender and no masses. Assessment, status post mastectomy, no recurrent at this time. Plan, follow up in 9 months. The code that can be assigned at these cases is PD. There has two code that suitable to assign this code. First, Z Z08, which is encounter for follow-up examination after completed treatment for malignant neoplasm. Second, Z85.3, personal history of malignant neoplasm of breast. The SD for these cases, they also have two codes, which is C50.911, malignant neoplasm of unspecified site of right female breast. Second, C50.912, malignant neoplasm of unspecified site of left female breast. The justification for these cases is patient come as follow-up at the hospital. Thus, the Z08 is for follow-up. The additional code with Z85.3 is used for history of breast cancer. The SD means for neoplasm for both sides of breast since done with bilateral mastectomy.
Now let's move to the guideline in Chapter 2. The guideline is about current malignancy versus personal history of malignancy. When a primary malignancy has been excised or has been removed by further treatment, for example, the additional surgery for the malignancy, radiation therapy or chemotherapy, if this further treatment is directed to that site, the primary malignancy code should be used until treatment is completed. However, if there is no further treatment, a code from category Z85, which is personal history of malignant neoplasm, should be used to indicate the former sites of the malignancy. But the code from the subcategories Z85.0 until Z85.85 is assigned for the former sites of primary malignancy only. But code Z85.89 can be assigned for either primary or secondary malignancy. According to the case, the disease included is the breast cancer. Breast cancer starts when cells begin to grow out of control in women's breasts. Breast cancer cells usually form a tumor that can only be seen on X-ray as well as a lump. Usually, breast cancer occurs in women, but men also can get the breast cancer too. There are several signs and symptoms of breast cancer. For example, a breast lump or thickening that feels different from the surrounding tissue. Other than that, the change in size or appearance of the breast, as well as the changes of the skin over the breast, such as dimpling. After that, redness or pitting of the skin over the breast, like the skin of an orange, also refers to the sign and symptom of the breast cancer. I think that's all from our group. Thank you.